So high blood pressure can be deadly. It's a primary or contributing cause of death to almost 700,000 Americans per year.
So to talk about high blood pressure and what you can do to protect yourself, we are joined by Johanne Morne, New York State Deputy Health Commissioner for Health, Equity, and Human Rights. So good morning, Commissioner. Thanks for being with us.
Thank you so much for having me. Good morning.
Good morning. So let's just talk about the basics here. What are the main causes of high blood pressure?
Sure, absolutely. So what we know as it relates to high blood pressure is that it has a lot to do with our life and our lifestyles, right? And so when we think about our activity, when we think about our food intake and think the opportunities that we have around making choices on smoking and drinking, all of these collective activities can contribute to a diagnosis of high blood pressure.
Okay, so I guess also, is there a genetic component to high blood pressure, right? Like my grandfather, high blood pressure, my mom and dad, sorry guys, they have high blood pressure, probably caused by me. So, is there a genetic component?
Well, to your point, environmental factors play a huge part too, right? And whether or not someone has stress and high blood pressure. The genetic component, really, if you think about it, is thinking about generational behavior too, right?
Oh,
and
yeah.
so, right, we're raised, we have cultures in our household, we have traditions in our household, and we pass those down to our children and to their children too. So I'm not going to say so much around the physical genetics as far as our makeup, but I am going to talk about our external genetics as far as our traditions and the choices that we make and the opportunities that we have. A big part of it, and when you think about public health challenges, you think about high blood pressure, we know we have disparities in particular communities, right? And so Black and Hispanic individuals have disparities as it relates to a diagnosis of high blood pressure. And for some individuals, it has to do with community and the availability of spaces to do and make the choices that I was talking about before.
Yeah, can we take a look at those numbers? We actually have a graphic to break down the numbers because Black adults have a high level, like you just said, of high blood pressure, and Hispanic adults, though, are lower. Why is that? And because I would say both cultures have diets that are, rich in protein, high fat, but it's different. Why would it be Black?
Well,
yeah, go ahead.
No, I was going to say, when we look at disparities and we look at outcomes, right, we're going to see differences within that. And I don't want to make any suggestion or have anyone leave from hearing this conversation to take away that if you're Black or if you're Hispanic, what it has to do really is with the environments that we're in. And the opportunities. So, for example, if I'm saying to you, get out there and exercise, get out there and walk, and you're in a community where there really aren't spaces that are safe to walk in, right? We see in certain communities, we have new bike lanes, and we have new advantages in which people can get out there and exercise and feel safe about doing so. But if you don't have those opportunities or green spaces, as we call them, then we're creating sort of, if you will, a wish list that's going to be really hard to fulfill.
So help me understand that then, because rural upstate Jefferson County is actually doing the worst, right? With 44% of adults having high blood pressure, and then looking at the metro area, the lowest rate is Manhattan. So a green space up north actually has higher blood pressure than those in Manhattan.
Well, so, what I'm going to say is that I haven't lived in either of those areas, but what I'm going to ask and suggest is this. Let's take a look and let's look at the opportunity of what foods are available to us.
Okay.
Is it a lot of processed food? Are there opportunities and differences in markets, whether that be fresh markets out in the community, traditional markets as we know them? There are a lot of different factors that go into what determines our health outcomes.
Plus, they probably don't walk as much as we do in the city. When they're out there, they're just jumping in a car to go to the grocery, whereas we're walking to the grocery.
Oh,
right.
I absolutely learned that every time I come down to New York City. Yes, absolutely. There's a lot of walking that goes on.
Yeah.
There are a lot of different factors. And again, I talked about smoking and drinking. Now, does that mean in moderation that you can't have a drink? I'm not suggesting that. But the word moderation is really key when we think about any of the things that we do. And does that mean you can't have a good treat once in a while? No, I'm not suggesting that either. I think that when you look at diets overall and you look at nutritional values, it's about moderation and about making choices that every once in a while you have that exceptional treat, right, or that drink, but think about your daily practices and
yeah.
what goes into your daily practice.
Good advice all around. New York State Deputy Commissioner of Health, Equity, and Human Rights, Johanne Morne, thank you so much for being with us this morning. Appreciate it.
Thank you. Take care.
You too, and we'll be right back.